Hi, my name is Paige Heimrich, and today I'll be discussing health literacy pertaining to preventative medicine. I'll be addressing the following questions. What is health literacy? What is the importance of patient education? And why is understanding preventative medicine important among patients? Center for Disease and Control and Prevention, also known as CDC, defines health literacy as the degree to which an individual has the capacity to obtain, communicate, process, and understand basic health information to make appropriate health decisions. Patients being educated about their health issues is important due to the increase in hospital usage, misuse of medications, and in some cases, higher mortality rate without the proper education. Understanding preventative care is important to stay on top of one's health. Being compliant with screenings can monitor changes in your health. For example, mammograms can show masses in a patient's breast, colonoscopies can show polyps in a colon, etc. Following standard preventative care can prevent a serious condition from worsening without knowledge or correct care. There are many solutions to increase patient literacy. U.S. Department of Health and Human Services suggests for patients to ask for written or visual forms, ask doctors to use plain language, and/or request information that is clear and easy to use. Following these suggestions, I've came up with the perfect handout that covers all the bases. This written handout is in plain language, has a larger font size for patients with slight vision barriers, has pictures of what the procedure looks like, as well as how to read the results that come in the mail. Using mammograms as an example, I've put together a health literacy handout that can help patients understand the preventative screening. The handout includes what a mammogram is, what it tests for, what the appropriate ages are to start, tips for going in for the screening, and terminology to know when reading the report. This health literacy handout will help patients not only understand why preventative care is beneficial, but also gives them some insight on what to prepare for in the results. Readings like benign or probably benign can be scary to anyone that doesn't hear those terms on a daily basis. How much will it cost? Patient education and health literacy is priceless. Regardless, I understand that cost is important to stay in budget. The cost is broken down into the price of materials. The materials are averaged out. For example, a ream of paper of 500 pages is about $8.29. Ink that prints out about 1,500 pages is $114.89. Hourly charge is $20. Total per page would come out to about 10 cents. To help bring more handouts for preventative care to life, I'd like to invite doctors in the office to help bring ideas as to what information they would like included in the handouts. I believe that doctors' insight on health literacy among their patients is important because they know their patients best. A draft will be provided for each provider so they can read and make changes when they have time. I will review the changes made, make a final draft, and get approval from each doctor to ensure that information is accurate. Our end goal for health literacy and what we hope to achieve with this handout is increased preventative screenings among patients as well as patient education regarding their health. Patients will learn what preventative screenings are and the benefits of the outcome. Knowing what is going on with patients' health will help them have the providers correctly diagnose and treat what they may have.